Thanks very much, Cathaoirleach. Minister, I wish to raise the issue of the lack of a designated expert in the HSE to provide clinical care to those individuals who suffer from Ehlers Danlos syndrome. Minister, you will be aware that EDS are a group of syndromes of connective tissue disorders, and the way in which they affect patients varies greatly. The impact that it has on certain individuals. And for some, the condition can have a profound impact on the quality of life. It impacts not just on their health, but indeed in many cases on the individual's mobility. That can range from relatively normal to very severe. I wish to raise with you two cases in Clare that I am familiar with, one of Aoife Sage and the other of Zara O'Gorman. In Aoife's case, she was diagnosed at 9 years of age, and since then her condition has deteriorated rapidly, from initially just some weakness, fatigue and episodes of fainting and dizziness, to now joint pain and the requirement of a wheelchair. She is now 14. She suffers from an instability of the neck, where in certain movements her neck becomes dislocated. And you can imagine the impact that that has had on Aoife. She is unable to attend school. Even her condition now is such that homeschooling is just not an option for her. And there is no care available in the Republic. She has had visits to London for certain scanning, and there is some assistance there. However, her condition, bad and all as it is, can be improved, and her quality of life can be improved, we understand, and her mobility can certainly be improved if she is able to get access to a surgical intervention that fuses certain aspects of the head and the spine. I am no medical expert in that regard, but I understand from her parents in particular, who have consulted with a private clinic in Barcelona, and I am aware that in the case of Zara O'Gorman, the same solution, if you want, is there. I am also aware, Minister, that there are a number of other cases throughout the country, relatively small in number, but who we understand would have a very significant positive benefit to those sufferers if they were able to get access to this surgery. The difficulty is that the state is not in a position, or currently hasn't been in a position, to provide funding, because the care that is available is not in the public service, as I understand it, or as I am able to ascertain, anywhere in Europe at the minute, but it is provided for in this clinic in Barcelona. Now, Minister, I think it's pretty clear at this stage from what I have seen and read that this intervention would have a very significant positive impact on the lives of the two girls that I am familiar with. I think it's incumbent on us, not in this House and in your department, not to stand back from intervention just because it's exploratory or it's early stages, when there has been recognised positive benefit for others. So I would appeal to you, Minister, to look at the cases again. I know there has been some communication with your department from these families and from others, with a view to providing funding at this stage to ensure that these children can be treated in the private facility in Barcelona, and then look to developing our own skill sets here, so that we can try to be in a position to treat other individuals who will present at a later stage. I accept that overnight it's not going to be possible to put in place that clinical care and that surgical intervention here, but it is available elsewhere, and it's incumbent on us. Like, I met with the parents and Aoife's in particular. They're doing a crowdfunding exercise at the minute. Like, I attended an event in Shannon the other night where, you know, the families and friends from the areas that they have lived in Six Mile Bridge, Shannon and Newmarket, came together in desperation to try and put the funds together to help this family. The people on the ground get it. They understand the positive impact and benefit that can have on this family. And I have to say, anyone that I've spoken to who know the family and know them in some cases better and longer than I do, they know this is genuine. They know this will make a difference if the surgery can be achieved and done successfully. But it can't be done without money. And I know we've come through a difficult time in this country, but in this day and age, to see a family effectively begging their neighbours to collect the wherewithal to have medical service provided to their beautiful daughters. It says a lot about how we as a society react to children in dire circumstances. So I'm hopeful, Minister, in fairness to you, in your department, you have shown great compassion, you have shown a great capacity to address serious issues when they arise. I'm hopeful that you can do the same here, and hopefully you'll have some good news, and hopefully you'll be in a position to meet the parents of these two children, to act as a representative, if you want, for others who suffer the same condition. Your commitment, at least, to meet with the parents, and I'll be in contact with your office, and we'll try and arrange that in the next week or so. I think what's clear from your answer is that the HSE are still of the belief that they have an appropriate plan and an appropriate model of care to deal with the complex cases. And from my interaction with the families, that's not the case, and hopefully that will be brought home to you when you get an opportunity to meet the parents. Some of this is exploratory, but the reality is that there has been really good work done in Barcelona on this cranial fusion and fusion within the spine, and I think you need to see some examples of that. Of course, the HSE will obviously want to manage from within, but we have to be prepared to look elsewhere, as we do with the management of other diseases where we access care in other countries where we don't have the specialist training here. These families are familiar with what can be done, and for sure they want to stand by their daughters and they want to give them every chance. And I think we, as a state, have a duty and an obligation to assist them in that regard. So rather than getting into a set piece here, Minister, I think what I'd now like to do is engage with you in your department with the families to try and find some way of assisting them, because I don't think it's fair, recognising everything that they have to do for their children at the moment, that they should be spending valuable time trying to fundraise from a community that are prepared to help. But the scale of the monies that are required, you're talking in the region of up to 100,000 to cover everything in terms of the relocation to Spain for a period and all of that. And to think that a community like Clare would have to do that for two families is just a burden. I think that's too much. And I think it's incumbent on us, I know it's incumbent on us, to resolve the matter here and to do it, if necessary, by some way of a pilot project or a pilot programme, so that we will learn and benefit from it, so that other children who present at a later stage will have the benefit of the learning that these families will hopefully be in a position to provide us with.
Thank you, Deputy. Hannah.
Dooley, I want to assure him that my answer is not meant to in any way suggest that everything is absolutely appropriate and adequate here. I do believe we need to do better. That's why I very much welcome the new clinical programme that is being worked on, which EDS is a part of. I think that is something that will be welcomed by patients and their families with EDS in this country. But I think the Deputy is entirely correct. The voice of the patient, the voice of their family, is really important as we develop these plans. And I'd very much welcome the opportunity to meet with Deputy Dooley with the families he's referring to in the coming weeks, so that we can make sure they have their input and see if we can do more to support them as a state.